I was asked to talk about the advocacy specifically over the past 2 years, but those of you who have known me know that when I present at AAP and when I've presented at APSA, it has been largely on health inequity and health disparities. But specifically, I started an organization 2 years ago, and why was because in Philadelphia, African Americans were impacted by coronavirus disease more than any other group. And in March of 2020, all we had was testing and contact tracing. Unfortunately, all of the testing locations were in affluent white neighborhoods, and none were in the zip codes where people were impacted the most. Since I went into private practice, which I remember presenting at Benji Brooks about 5 years ago, I had my own infrastructure where I was in network with insurance companies and in network with LabCorp and Quest, so I could request the test just as all the hospitals could. And with phila.gov, went on the website to find out where the positivity rates were the highest and took the PPE from my office and went to the communities where the positivity rate was the highest. Initially, I did that door to door with my husband right there, driving the van around the neighborhoods. You can give him a round of applause for that. With my husband driving the van and some pediatricians and family practice doctors and medical students that were now no longer in class with the PPE that I had, and we did that. And then because it was African Americans, we were proximal, so we went to the communities into an edifice that they trusted, which was the Black church. So with my pastor, reached out to those church pastors and said, can we use your parking lot? That's all we needed was the parking lot. And with that, brought the testing supplies and began to test people. At the time, 1 in 4 people, 25% positivity rate happened. The work, I used the infrastructure, the obstacles, my goodness, I don't know where to start. But at the city level, it was something you couldn't fix overnight, that all of the places to get tested were not in the communities that were impacted. That was systemic, that had happened over a long period of time. At the state level, they were waiting for the CARES Act to be passed before any information could be disseminated. So I told LabCorp to bill me. And so for every COVID test, that was $50, and I can show you the bills, I was billed for those tests because no one needed to die for a test that was $50. And afterwards, they passed the CARES Act, and now I could submit to be reimbursed for some of the testing. And then the insurance company said, well, wait, you're credentialed as a pediatric surgeon, but you tested adults. We're not going to pay you for that. And I said, you need to check again, because I'm also board certified in adult general surgery. And last I checked, that was a procedure I could perform. And so my future direction, because people started coming to us, and as you heard Dr. Carmona say, it's that trust and the advocacy and the person who is spreading the message. And so when the vaccines came, they said, Doc, do you think I should do it? If you say I'll do it, I will. And again, had to fight with the city of Philadelphia because the narrative was African Americans will not accept the vaccine. We don't have enough, so we can't give it to you because we don't want to waste it. I said it depends on where it's being given, who is administering it, and who is doing the educating. So I had to fight with the city of Philadelphia to get vaccines in the communities that were most impacted. And we vaccinated the first day 500 people in one day and used them all, and ultimately were able to vaccinate over 55,000 people. Finally, the multidisciplinary practice came out of people coming to us for everything, waiting in line and saying, I know I already got vaccinated, but can you look at this lump on my neck? I know I already had my COVID test, but I'm not sure what these medications mean. And so again, because I knew how to start a practice, got my friends together and opened a multidisciplinary where we see children through adults in 19132 in Philadelphia, which is the lowest life expectancy in the city. And that's where the center is located. Then January came, and I got tapped to come and bring some of the local work that I was doing and expertise to the national level. Very humbled by that, and fortunately, because I planned ahead, I had people in line to continue the work. So that is still happening. I'm excited that all of the things I learned through APSA and as surgeons, that we don't take no for an answer, and we have a plan A, a plan B, a plan B, C, and D, and we're ready. And so that not saying no, being proximal to the people, and then also being able to speak to the policymakers, as Marion said, I believe is what allowed this to be so successful. It's not over yet. Thank you for the opportunity to share, and I'm looking forward to the discussion.